using homeopathic remedies, traditional Chinese medicine, acupuncture, and a variety of alternatives has been an important part of maintaining the health of my family members. So from that perspective, I've been very concerned about the possibility of infringing on the choice that people might have to use naturopathic and other complementary and alternative modalities and the products that they use, many of which have been used in traditional medicines for hundreds, if not thousands of years, and are important to maintaining health, preventing problems, managing chronic diseases. An additional aspect about the complementary medical system is that it tends to be supportive of people really taking self-responsibility for their health, changing some of the lifestyle aspects that may be not conducive to their health, stepping forward to take responsibility to prevent problems by eating well and using nutritional supports and herbal supports before there's clinical problems. So that self-responsibility is increasingly important in our society as the demographics change, our health, the allopathic medical system is overburdened with the demand on it, and the costs are escalating and taking larger and larger percentages of provincial budgets. So as I've been listening to the concerns of people in my community of Vancouver Quadra, whether it's from the perspective of the fines and enforcement measures in this proposed bill, and I appreciate the member from Cambridge mentioning some of the proposed amendments that the government is considering. As I've been listening to people from the Association of Naturopathic Physicians, both here in British Columbia and nationally, I recognize that there are real concerns with this bill, notwithstanding Health Canada's attempts to reassure people that it essentially changes very little for natural products. There are remaining concerns, and I want to just flag some of those. One of the concerns, of course, has to do with the intent to lump natural food or natural products in with therapeutic drugs. And here's one example, or there's one article which points out how completely unacceptable that would be. This is an article from the Vancouver Sun on the 3rd of June, and it reports on a study which took place at the Vancouver General Hospital, and essentially concluded that 12% of patients who rush to the emergency room at Vancouver General Hospital are there because of adverse effects from medications, according to study findings that were published that day in the Canadian Medical Association Journal. The 11 international authors of the study said patients with medication-related complaints are more likely to be admitted to hospital beds after they've been seen in the emergency room and occupy those beds far longer than others, a result the authors described as striking. The study estimates that 70% of such visits are preventable through better prescribing, dispensing, and monitoring of patients. And in quote, "We've proven in this study that we have a problem in the healthcare system with patients who experience bad effects from medications, and we have to figure out how to reduce those problems," said lead investigator Dr. Peter Zed, who was working at Vancouver General Hospital during the study, but is now at the Queen Elizabeth Health Sciences Centre in Halifax. Problems stemmed from a variety of issues, including patients being prescribed the wrong drugs, given wrong dosages, allergic actions, interactions with drugs, and patients not following instructions for how and when to take their medications. I think the key that one can take away from the fact that essentially 1 in 9 emergency room visits in Vancouver General Hospital relate to pharmaceutical medications is that this is a very different category of product to take than natural products, herbs, traditional Chinese medicines. There are some adverse effects that have been put forward by Health Canada and the members from opposite the aisle to suggest that natural products and herbal medicines also can have adverse effects. And I'm not going to argue that there may be cases where there has been where there are products that are not 100% what is claimed to be in the container, or ones that are contraindicated with other medications people might be taking. However, 1 in 9 emergency room visits due to pharmaceutical drugs versus the record of natural products, herbal medications, homeopathics, organotherapy, and the other kinds of products that would be lumped in with pharmaceutical drugs in the Act as it reads now. So I am very pleased to hear that amendments to create a third category are being considered, given that until very recently Health Canada was denying that there would be negative impacts from the way the bill is currently structured. I am going to be very, very vigilant in following the debate as this goes forward. I have a letter from a constituent, Brian, who says that I'm writing to you as one of your constituents to express my concern about Bill C-51 and the impact it will have on the ability of my naturopathic doctor to treat my health concerns safely and effectively, as well as my access to natural health products that I currently purchase. As an informed patient, I have chosen to be treated by a naturopathic physician utilizing natural therapies and substances to ensure optimal health. I would like some assurances that my choice to see a naturopathic doctor or purchase natural health products in the store will not be negatively affected by Bill C-51. So I am focused on the response of the naturopathic physician community, because that's where my knowledge is strongest, and those concerns remain. I have a letter from this is actually a public posting from a physician, a naturopathic physician in Nelson, BC, who's the current president of the College of Naturopathic Physicians of British Columbia, Dr. Lawrence Swetlikoff. And he acknowledges that Bill C-51 appears well intended and seems to strengthen the manner in which all health products will be regulated. However, as you delve into the details of the bill, you discover the potential for disaster that it poses for the practice of naturopathic medicine in Canada. And a couple of the examples of the concern that is being raised by the naturopathic community is that the bill introduces a new term called prescription therapeutic products to refer to any product, including natural products, that are not included under the current natural health product regulations. And it states that these products can only be accessible by a practitioner. However, of great concern to Dr. Swetlikoff and other naturopathic physicians is that under this bill, prescription therapeutic products require a prescription from a practitioner, and currently naturopathic doctors do not have prescribing authority and are not designated as a practitioner in Canada under our federal laws. So essentially that would mean that there would be many products that the naturopathic physicians are utilizing to maintain the health, to prevent problems with their clients, and to manage chronic diseases that would no longer be accessible to them. Of course, they could be prescribed by an MD, but medical doctors are actually not trained to utilize those kinds of herbal and non-pharmaceutical drug products. So they could become inaccessible, and I think it's critical to understand that this does affect many patients, because many people use the services of naturopathic physicians. They are physicians who have been trained in 7+ years in post-secondary education, and to say that a naturopathic physician can no longer encourage or prescribe a patient to use a herb like St. John's wort is completely outrageous.